Hello, I'm Jared Hall. I'm here with Lacey Runyon, and we are going to discuss a patient that we've previously discussed and as part of the consultation assignment. So, um, as we've discussed, Lacey, the patient in question was a 21-year-old football player. Um, that was that had injured his ankle, and it was something that we thought was minor in nature, grade 1, grade 2 ankle sprain initially, and found out after um, further evaluation that it was much more involved. So we'll talk a little bit about some of those dynamics, but um, basically what the situation was is this individual we were doing practice on air, in pro pads. So it was a typical Thursday practice going into the weekend game. It was an in-season injury, and the individual, what he did was they were doing 7-on-7 drills, and he had gone up to knock a ball away from he was a defensive back, okay, and he went up to knock a ball away from a receiver, and when he came down, he didn't get up right away. So I go over, and presented with typical anterior lateral ankle pain. Nothing really out of the ordinary. Fracture signs on the field were negative at the time, and the one thing that was kind of confounding there was that he was unable to bear his full weight. But nothing.
So with the new ankle injury, that's something that you expect, especially.
So we put him on the back of the gator. We take him up. We do our normal things. We get ice on it and elevating him once we got him in the training room, and the typical rice things that we all do. And so then never thought anything about it. But the next day when he came in, of course he had a lot of swelling and so forth. The other findings were he had anterior lateral ankle pain, and he was tender along the mortise. But again, what ankle sprain, what acute ankle sprain is not. So those were kind of the things that we had discovered in a quick sideline evaluation. And then the following day he presented. I felt like it was worthy of getting some diagnostic type exams. So we called the team physician. He agreed. Sent him out there, and lo and behold, he ends up with a talar dome fracture. Something that we see in skiers.
Right.
Which isn't our population that we see a lot. So, those were some of the things that kind of surrounded this individual's case. So, I felt terrible at the time because I thought, gosh, did I miss something here? Did I not do my job? Because he comes back, I'm anticipating, or all fingers are pointing towards a, acute ankle sprain, grade 1 plus 2-ish. And, lo and behold, he comes back with a fracture.
Yeah. I know that something I learned from one of the orthopedic physicians I've worked with over the past was anytime that they have like that anterior ankle pain, is he suggested that I do like a forced dorsiflexion test to test that like anterior tib fib ligament if I think that there's something wrong there. And not that I know or think that would potentially rule out a talar dome fracture, but I'm assuming that would have probably given you some pretty intense results of pain and discomfort. And usually when you're doing that, you're forcing them up, and you can kind of feel the sponginess of that anterior tib fib ligament. But in that case, it almost sounds like you would want to do something or find out if something with a more like rotational force could help you, maybe notice like crepitus or popping in the joint or something like that, to lead to a different diagnosis. in that way. And again, I would have never come up with some of those things other than working with that ortho. He sort of was like, these are things I like to do when I see these things present.
Yeah, and in discussing with our team physician afterwards, incidentally, the individual obviously was out the remainder. And it was kind of sucked because he was senior.
Mm-hmm.
It was his senior year, kind of ended his career. But he's obviously casted, and he had a good result in the end. But in discussing that with the team physician, he also felt like it kind of reassured me that it's kind of an incidental finding, not something that you would typically find upon exam, at least with
exam, no.
With a typical
Ankle sprain.
Yeah, but really you need the diagnostic imaging to get that differential diagnosis.
Definitely. Like I said, there's a test for the knee, and it's like for meniscus damage, and you stand on one leg and you twist, and I almost wonder if that wouldn't be like a helpful test in that case. But I think that what would be helpful is maybe moving forward, like if you could look at what special tests are good for identifying, not necessarily like talar dome fractures, but maybe like damage to the talus or the mortise joint specifically. Because I mean, like, you're going to do your go-to ankle test, especially in an ankle injury, and I'm sure the athlete had a standard mechanism of injury. What happened? Oh, I jumped up and it came down on a roll, turned my ankle in or whatever.
Yep.
Unless he says something like, I landed hard and my foot was forced up, which no athlete is ever going to say.
And we did the typical run-of-the-mill bump test, squeeze test, talar tilt, Kleiger's, trying to rule out different things, and nothing was really positive other than he just had, lots of pain over the mortise, and that may, kind of looking back now, maybe that should have been a kind of a key finding that.
Yeah, it's really difficult though, because with an ankle injury, I mean, there's so many times when you're palpating various areas that they're going to say, oh, that's painful, or that's painful, or that's painful. So to just be like, oh man, I missed it, I mean, that's really hard. You're really going to have to work to find the specifics of that. And I think probably moving forward now, you're going to maybe do some testing. If somebody says, like, you know what, I'm having a lot of pain over the mortise, you're going to be like, oh, well, let's do this. Or, maybe put him in plantar flexion and see if you can palpate that. I mean, best as you can in that position, that talar dome.
Well, yeah, and I think too, the clear aspect of him not being able to bear any weight.
Right.
But again, it's one of those things when you're working through things, and he doesn't have a history of injury as far as previous injury to that ankle. Most of the time they can't bear weight right away.
Right.
And so that's why I kind of waited till the next day, and obviously things kind of ramped up from there.
Realistically, your athlete's going to tell you what's going on. I mean, he's going to progress through the injury phases and let you know, like, this is not acting like a normal ankle sprain. So it sounds like, getting him to the imaging was the way at the time, and now you'll just address it. You'll probably be a little more cautious when you have certain injuries.
Yeah, definitely. So, Lacey, thanks for discussing with me today, and that's my take on a talar dome fracture that was kind of giving me some fits with one of my recent patients.